This is a quick guide to collecting blood cultures. You'll want to collect blood cultures when you have a patient who you're working up for sepsis or fever. The most important thing is to try and collect blood cultures before antibiotics are started, because if there's antibiotics in the blood that you collect, then they'll continue to kill the bacteria while we're trying to culture it in the lab. Most of the time, collect blood from a peripheral vein for culture. There'll be some exceptions and we'll discuss those. The key, as with any procedure, is to have the correct equipment with you. Take a careful look at your blood culture bottles. You should have one of each colour, they'll cut, so a pair, and one of them will be specifically for culturing anaerobic bacteria from. You'll use these alcohol prep pads to clean the rubber membrane that's on the top of the bottles, currently covered by these caps. You need an antiseptic swab on a stick for cleaning the patient's skin. This is how you draw blood percutaneously using this special kit, which contains a butterfly for drawing blood that will pass the blood along a tube and into a holder that will fit with the vacutainer system, including the blood culture bottles. For drawing blood, you'll need a tourniquet, of course, cotton wool or rubber band or a band-aid for afterwards, and gloves, of course, and a sharps container needs to be present at the bedside. So this is the procedure. You clean the skin, perhaps first with alcohol, and then with your swab and the stick, making increasing circles of increasing diameter over the vein. Then get your blood culture bottles ready and look carefully to see where the level is that's 10 mils above the level of the culture media. You need to collect 10 mils in each bottle to make sure that you can that the test is